Access Supine accepts breast thermoplastic for enhanced breast positioning. This setup requires a 30 by 45 centimeter breast thermoplastic sheet, a pair of Opti-Handles, and the Access Supine breast adapter with swivel locks. Secure the breast adapters to the Access Supine. Each adapter mounts via 2 screws secured to the lateral sides of the Access Supine. Next, screw in the swivel locks. These will hold the breast thermoplastic in place. Keep in mind the lateral scale will not be able to be used in conjunction with the breast thermoplastic adapter, as it will cover the lateral scale. Place the thermoplastic breast sheet between the Opti-Handles and secure in place. The thermoplastic sheet with Opti-Handles attached is now ready to be heated in a water bath or hot air oven. Assist the patient onto the breastboard, with their affected side close to the breastboard's lateral edge. This position will help ensure that the thermoplastic sheet forms snugly up against the patient's chest wall. The Access Supine's head and arm supports adjust laterally to accommodate this position as needed. Once the proper setup position is confirmed, the 3-point reference marks can be applied as a guide for the patient's daily repositioning relative to the breastboard. The breast to be treated can be taped into an upright position beforehand to aid in the setup process. 2 therapists are needed to properly form the breast thermoplastic. Remove the breast thermoplastic sheet from the water bath or hot air oven, being careful not to overstretch the sheet. Dock the Opti-Handle on the ipsilateral side and hand over the other Opti-Handle to your assistant, who will dock it on the contralateral side. Lift and shape the affected breast into an elevated position, making sure that the breast tissue is not migrating from underneath the sheet. On the contralateral side, compress the breast downward to create a clear medial beam path. Press the sheet down upon the sternal region as well to prevent the medial breast tissue from migrating. Once the sheet has hardened, it can be marked to indicate isocenter. For additional repositioning, a circle can be drawn on the sheet signifying the location of the areola. Additional marks can also be drawn at the superior and inferior edges of the thermoplastic sheet at the sternum to aid in repositioning. For daily repositioning, align the patient back onto the Access Supine according to their setup sheet. Dock the thermoplastic sheet first on the ipsilateral side, and as the sheet is brought over the patient, scoop the affected breast up into the thermoplastic mold, capturing it back into the cast. Next, dock the contralateral side in place, compressing the breast back into position. Ensure all breast tissue is properly contained within the thermoplastic sheet. Utilize all additional marks to ensure proper alignment between the patient, breast tissue, and the thermoplastic sheet. If you need further assistance, CQ Medical offers in-person and live web-based trainings and product demonstrations, and we have clinical specialists around the globe to support all your needs. CQ Medical. Care smarter.